April 5th, 2022. I'm not going to say anything about this. I'm just going to let the reporter report what they were talking about supposedly today. Today's April 5th, 2022. In my sequencing on the TV, this is like current events for me. The closest thing to current events that I have. This is the outlet, or this is the news, whatever. I don't know what the words are that they use in the professional industry. But this is regarding the corona.
Now to the pandemic, and as we told you earlier in the show, the White House today announced a new task force designed to speed up the nation's response to long COVID. The members will focus on researching how to help people who are suffering. So we want to bring in ABC's chief medical correspondent, Dr. Jen Ashton. Hi there, Jen.
Hi, Liz.
She's going to talk much more about this. So why is long COVID such a problem, and what do you think the goal is of this task force?
Well, first of all, this syndrome, which we don't fully understand why it happens, is thought to affect anywhere from 10 to 30% of people who have had COVID, even mild cases of COVID-19. And it really produces what can be long-term and chronic and often debilitating symptoms ranging from psychological or cognitive issues to respiratory problems to fatigue to musculoskeletal pain.
Now, I'm experiencing in my whatever this is in peaked and pallor, and what I refer to as white, but peach perhaps, I'm not quite sure. So it's really confusing because those are symptoms I've actually been experiencing and reporting on. But listen to how Dr. Jennifer Ashton, how she messengers it and how she reports it to anything at like couch potato level for the evening news that relies on this as some form of like guidance.
So this task force is really set out to really research this syndrome and provide attention to other groups like pregnant women and black and brown populations that have been largely kind of ignored at some points in this pandemic, but a lot of...
Now that's interesting. Black and brown that have been ignored through the pandemic. Is that an accurate statement? Because throughout this pandemic, all I see on the news are like black and brown messengers. They're in the commercials with the drug companies. I mean, like, they're participating. They're in the sports arena. They're in the gaming industry, and they're in some kind of optics with cables and cell phones. I mean, they're in everything. So how on earth does she say that they've been ignored? They're everywhere on the TV in the same time that this corona pandemic's been going on.
Opponents of this, Liz, or critics, I should say, are saying we've known about this for quite some time, and the administration could have taken these steps as early as a year ago, because we're talking about potentially millions and millions of people who are suffering with this.
And we are 2+ years into this pandemic now.
Yep.
All right, Jen. The CDC director now says if you are 50 or older and had Omicron around Christmas time, that you can wait to get your second booster. So I guess we'd be about 4 months or so. What's your take on it?
That's right. And, she's basically talking about someone like me. I had COVID myself in January. I am choosing to wait a few more months for my second booster dose. But I think the important thing here, because when people heard about the authorization of the booster for people 50 and over who are 4 or more months past their first booster dose, remember we talked about the fact that the administration is is calling it an option. It is not a strong recommendation. And I think the reason for this confusion is because there's a difference between public health recommendations, which are really made for the entire country, and that individual doctor-patient advice, which, really speaks to there's no one-size-fits-all to this approach.
Right. We have seen the numbers go up, and the new.
I mean, that needle injection creeps me out. I find it like, for me, that visualization is just as difficult to watch as, say, a gun exiting a bullet chamber and shooting someone dead in the street. It is just as difficult to watch for me. I'm not wired for it, and but it's all day, every day for psychological witness torture or tampering. I mean, they use it as the overriding in this innocuous way that is your visual adhering whatever whenever you hear the words corona pandemic or COVID. It's a shot in the arm, and that there's some form of health benefit associated with it in the area, which is another layered psychological problem that's going on. So this mental disease is not there's a proponent of it, but they're in some form of designing of it as we go, as history in the making. I mean, it is just holy good Lord. It's star 1978, star 8378, Nicole, Cattaruzza. It's Earth, solar system, Milky Way, universe, galaxy is broken, and it's Bayside Station, Bayside, New York, 11361.